Hey guys, Dr. Sam here, and so today I want to show you how we treat a lot of the chronic knee pain that we see in the office. So a lot of our patients that come in will complain of sometimes lateral and medial patella pain. So over here is lateral and medial knee pain. Sometimes they'll complain of patella pain. Sometimes just they say things like their knee wants to just give out. So I just want to show you some of the therapies that we use to actually not only reduce pain, but also to regenerate the actual tissue in the knee. And first one I want to show is something called shockwave therapy. So shockwave uses hypersonic sound waves that travel and penetrate into the tissue. And then what they do is it rapidly decreases inflammation at the areas that we're treating. Usually our patients will see anywhere from about a 20 to 50% reduction in pain even after the first treatment. But what's really cool about shockwave therapy is not only do you get pain reduction, but it also improves blood flow to these areas that have very poor blood flow or vascularization. And the best part is that it actually recruits your body's own stem cells to heal and fix the injured, damaged tissue. So it's not just a Band-Aid type effect where you're gonna feel better for a couple days and then the pain comes back. We're actually regenerating and actually healing and fixing the damaged tissue that's causing the pain in the first place. So usually we'll treat things like on the outside, device is pretty loud, so I'm not going to run it while we're talking here, but we'll treat things like on the outside of the knee, up into the IT band, especially if people have pain going down the stairs, all up around the kneecap, and even on the inside of the knee. It's completely, this thing is totally safe. It's non-invasive, so there's no surgery. There's really no downtime, so people can actually get back to their activity the exact same day. So really cool stuff. I'll show you the next thing we do here. All right, so one of the other really cool devices that we use in the office is something called a rebuilder. So oftentimes what we'll find with folks that have chronic knee pain is not only do they have degeneration in the joint or what's called osteoarthritis, but we'll also often find that they have nerve damage, which leads to a lack of muscles firing around the joint. So when nerves can't communicate to the muscles can't fire, they can't support the movements that you want to do, which leads to that feelings of pain, feels like the knee's going to give out, and just that general discomfort that you have. So not only do we want to reduce the inflammation and start to regenerate the tissue, but then we also need to regenerate the actual nerve communication to the muscles that support the joint here. Why is that important? Because you want to get back to doing what you want to do, right? You want to get back to hiking, you want to get back to playing with your kids, you want to get back to walking and be able to move up and down stairs without pain. The cherry on top of the sundae is something here we use called cold laser therapy. So cold laser therapy, just another way for us to not only reduce inflammation, but it also helps to improve blood flow into, these areas that have really poor blood flow. So if you're curious about our therapies, if you're curious about our office and how we can help you get out of chronic knee pain, I invite you to schedule a complimentary consultation. Let's have a chat, let's find out what's going on, and let's help you get out of pain and get back to, again, doing the things that you want to do in life, whether that's hiking, whether that's biking, playing with your kids, and just overall enjoying a higher quality of life.